So work has been changing a lot. And then in the last 2 weeks, there's COVID-19. And that's absolutely changed work in a different way too. So let's switch over here and talk about that. And thinking about COVID-19, go back to our polling software. You should still be logged in here, but maybe you could answer with what proportion of your employees are working primarily from home since COVID-19 precautions have been put in place. So this is, for example, is me, as they closed down the University of Iowa, and they told us all we needed to go home. They don't want us here unless we're essential employees. We can see that we've got most or nearly all of our employees are working from home. And I'm hoping we'll have time, Tanya, for a chat. I don't know if anybody wants to chime in with anything at this point or not.
Sure. I thought maybe we would do some chatting at the end, or field some questions at the end if you're comfortable with that.
Yeah, let's go ahead. So.
Okay.
So we can see that there's been a big shift in the workplace. And when you're working from home, you've got different challenges. You might have children, pets, spouses, neighbors, all those sorts of things can impact your ability to focus. So how about this one? Another poll here. How does working at home make you feel? I'm not participating, but if I would say cold, because our furnace has been set down. And so I sit in the basement shivering. Isolated, lonely. That's a tough one. You know, you're used to seeing people in the office and having a conversation in the kitchen. It's hard to focus, you know, he's like, well, you know, maybe I'll throw in some laundry, or maybe I'll do this, or maybe I'll do that. You're not in the same workspace. I know in my house, we've got 5 adults and we've all had to carve out little spaces, and we're still trying to figure out where it is. Snacking, I'm eating more than I usually do at work. That could be good or bad. Somebody has normal. Maybe it's something you already do. You've got a good place set up, might be part of your routine. Unmotivated. That lonely keeps coming up. And, you know, we're in an odd time now because we're working with, a lot of us are working at home. And although we may have people around us, maybe there are people that are putting demands on us, or we're trying to watch children while we're at home, but we're also in a place where we need to social distance. So we need to have separation between us and other people. And that's going to create a lot of problems when we think about our connection with different people. The internet is good. I think this is a great way to talk to people, but in a sense, I'm sitting in a room by myself, talking to myself. So it's good to see words coming up there. I see more people are out there. Let's go ahead and move on. So thinking about those stressors here, how well are you being supported by your supervisor? Do you feel that they're there for you? They're ready to hear what's going on, strongly supported? Do you feel that, well, they're there, but, you know, they're not reaching out to me. I have to reach out to them. Or you feel pretty neutral. You know, my job's pretty independent, autonomous. I'm not too worried about being in contact. I know they're there if I need them. Supervisor support is another way to engage employees. So back to our hierarchy of controls here, getting into some specific guidance on COVID. Again, eliminate the hazard. I think that would be ideal. We would desperately love to eliminate the hazard from the workplace, but it's tough and it's not going to happen anytime soon. We're going to be in this position for a while, and we need to figure out ways to be able to respond to this threat. So when we think about solutions, we probably want to jump down to engineering controls. And these are solutions where we're trying to keep isolating employees from work-related hazards. So in workplaces where it's appropriate, if you're working at home, it may not be needed. But for those essential employees or the employees who are working in the grocery stores, the drug stores, the truck drivers, even the restaurants and the delivery people, they have an opportunity where they are interacting with people and may be at risk there. So if you're in a workplace, you can look at ventilation and air filters to try to clean the air there. Other things to think about are physical barriers, such as plastic sneeze guards like they have in a salad bar. There was mention that maybe in the grocery stores, they might have the cashiers work behind a plastic shield there. You could look at changing the ventilation, again, to try to keep exposure down. You can also look at administrative controls. So encouraging sick workers to stay at home. And that's probably not going to happen if there is no paid sick leave, because people need to work, especially if their hours are being reduced. But having a policy where even if you do have sick leave, where, you know, I'm going to stay home and do that. I was talking to a fire chief yesterday at another meeting, and the policy they have in place right now at their department is that sick workers need to stay home for 14 days. And he said he just had a cold, but he's showing that he's following the policy by staying home by himself for 14 days. So you want to minimize contact. Here's our social distancing, trying to do these teleconferences, doing meetings virtually, thinking about altering days or extra shifts so you don't have so many employees in a workplace at one time. And then certainly non-essential travel should be reduced. And I've kept this up here because it does have the travel warnings from the CDC that's available. Other administrative controls are having those emergency communication plans. So you want to have a place where people can go to get information. You know, the University of Iowa has created a website. Information is updated there daily. We get regular communications coming out from the university. We also get them from the dean of the college and from the chair of our department. Having workers with up-to-date education and training on risk factors and protective behaviors, cough etiquette, remember, cough into your sleeve, and also care of PPE. That personal protective equipment is becoming like gold, so we want to be sure that we can use it if reasonable, as long as we can. And don and doff procedures here, things where people might not think that you can be exposed, touching doorknobs, the gas pumps, workplace things, the elevator buttons, and making sure that the workers who are doing the jobs are familiar with the training. So if you think that we've got the high-end healthcare people who are working, but we also have custodial staff, we have the people working in retail, we have the truck drivers, and these are a diverse group of people. We want to make sure the training is appropriate for them and understandable. Other examples when we think about administrative controls is looking at personal hygiene. So having tissues, no-touch trash cans, alcohol wipes, disinfectant, disposable towels, things for people to clean up, practicing or requiring regular hand washing or using rubs. You should always do that before you take off, after you take off any personal protective equipment. And thinking about the personal protective equipment, you need to select it based on the hazard to the worker. And personal protective equipment comes in different shapes and sizes, and you want to try to match it to the individual that's going to be wearing it. We hope to be able to do this throughout, but with shortages, we want to make sure that it's fitted the best it can be. It should be consistently worn, and it should be worn so it's fitting. Regularly respected and maintaining it, but also the maintenance of it when you take it off. So this is a chart from the New York Times, and each bubble on the chart represents an occupation. And the bigger the chart, or the bigger the bubble, the more people that do that occupation. And what we're looking at on the y-axis, the vertical axis, is exposure to disease, and on the x-axis is the exposure to infection. And so if you look at this graph, in the upper right-hand corner, you have dentists and paramedics and flight attendants who are obviously having a lot of exposure to infection. But we see nurses and personal care aides, police. But then there's cashiers, a large group of people who are exposed, and childcare workers. And then our custodial people, And then we have our loggers down at the very bottom left-hand corner who tend to work in isolation, don't tend to interact with people, and probably are pretty protected in this work environment. So we want to make sure that the personal protective equipment that is available, it shouldn't take place of other prevention strategies, but we want to make sure that the people at most risk have access to those. So at this point, Laura Keniston, who works with our center, has developed a page on our website focused on employer resources here. The link is here at the bottom. You can find us at thehealthyworkforcecenter.org. And it has information from the resources that we think are the best. So OSHA, the CDC, and we also have broken it out into the states so that you can go directly to your Department of Public Health or Health and Human Services there. And then as we get more information about things like disinfectants, hand washing, we'll put that in there as well. So good resources here, a great place to start, and a one-stop shopping if you're looking for things, and we'll keep updating this. So switching back to you guys, what are the top 3 places where you go to get information about COVID-19 in the workplace? CDC, it's a good one. Well-being partners, also another good one.
Yes. Thank you.
Did you put that one up, Tanya?
I did. No, I didn't do that one.
Well, we'll see if anybody else puts it up because it gets bigger.
Oh, okay. I love that.
Yes. Public health departments, human resources, local health departments, the well-being. Oh, wow. Guys.
Well, look at that. Yeah. I love that. That's so funny.
Okay, we want to soon see the Healthier Workforce Center up there.
Yes, we do. Yes, we do. And I'm gonna highlight that some more when we get done. So I love it. You did such a great job.
So lots of resources here. Now, we also are going to ask you, I'm going to move to the next question, is what format do you want information from? I love that you're going to the Wellbeing Partners because that's your group. Those are your people. But do you want to receive information via email? Do you want to have it on social media, on a website, fact sheets? Do you want a short video, maybe a 5 to 10 minute video explaining one concept, something you can watch in between your meetings, or a short podcast you can listen to if you got to walk that dog? How do you want to get information?
Interesting.
Mm-hmm. And if you have, nobody's selected other, but if you have another, make sure you put it in the comments box or when we open this up. And then the last question I'll ask is, what information do you need? We have an A there. Might be an uncleared response.
Yeah, but it might mean everything. I don't know. That's funny.
So think about it. What do you not know? Or do you feel that your workplace, things are being handled? You know, do you want information on long-term effects? Do you want to think about how to keep employees engaged in health from home? That's a great one.
It's a good one. Yep.
You know, I think that's a tough one. Do people have, you know, space to focus on their health? You know, there's sometimes a sense when you're working at home that, oh, you're just watching Netflix, or yeah, you're logging in, but you're not really working. And I tell you, I was working till 9 o'clock last night, so I'm not getting that relaxed time there.
No.
You know, you still have to cook dinner, and I'm feeding people 3 meals a day.
Local resources, that's good.
That is a good one, you know, and those might be places to go to. I know on our social media, our Facebook page, the Healthier Workforce Center, we've been trying to share some of those resources for people in our region that, small business information, loans, information for different types of employer groups. Okay, well, I'm going to move on. Just again, this is our website, Toolbox Talks. We have videos, short podcasts. We have some fact sheets there. We also have a Total Worker Health Employer Guide that was developed with one of our partners in St. Louis. That's free. All of our resources are free and available. And you're welcome to use them and incorporate them into your workplace. So reach out to us. And I'll open it up to questions. And this is a new image developed by some of our students, the yellow and black thing.
That's cool.
Thought I'd throw it in.
So here's how we're going to do questions is I'm going to open up the chat box here, the chat feature. And all I need you to do is put yes in there that you have a question, and then we'll open your mic for you to ask those. So if you want to ask a question, please just put yes in there and post that to the chat box, and we'll start with that. So I'm waiting to see if we've got any here. Okay, so Sarah, why don't you go ahead and take yourself off of mute, and you can ask your question, Sarah Shirley. She's having mic problems today in general, so I'm going to unmute her. Hang on. Okay, Sarah, I have you unmuted. You want to try?
Sure. Hi, Tanya. This is Sarah from the Wellbeing Partners, and I was just sharing a question in case other people didn't share a question. So this is more for discussion because we've actually received this question from other employers, and I would love to hear, Diane, your expert opinion. Many employers have significant OC Health established programs or clinics on site. Should they be pushing with local health departments to actually test on their manufacturing or plant sites? Or how would you advise those employers who are asking us those questions?
That's a great question. And I'm going to be cautious in my answer because I am not a physician. But I think that as we move forward and we know that testing is very, very important here, it probably would make sense for them to reach out to their State Department of Public Health and see how they can become integrated into that process. I know that there are restrictions are being changed a little bit to allow more testing to occur more frequently, and that certainly could be an option, but they also want to be very careful to protect the people working in their OC Health department. And think about some of the programs that have been implemented to protect those workers. But I would start with the local Department of Public Health or the State Department of Public Health and reach out to them.
Good. Just a reminder, if you don't know where the chat box is, it's at the bottom. So if you get onto the if you drag your mouse across the bottom, it'll say chat, and then that bubble, that's where you can put your questions. So Diane, I have a question from somebody that's trying to help organizations much like you are. Iowa and Nebraska are very similar in the world of how we work. We have lots of small businesses. We have lots of agriculture, right? So maybe a little bit about what you're experiencing locally, or some of the things that are coming to you that you would like to share that are happening in your state that might be similar to what's happening here, which is really mostly people are they're scared about their livelihood more than and the pandemic is its own thing and the fear of being sick. But I don't know if you had anything you'd like to share related to that.
Yeah, I think it's a hard time for a lot of people. I think that people are really worried about their job. Will they have a job? Will they get paid? And what happens if they're not paid? The businesses are worried about, will they be able to keep employees on? And many small employers are either family operations or they become a very family-like atmosphere. So making decisions about laying people off is a really tough time. I think it's a brand new world out there. How we do business has really changed. And I think some people are really quick to adopt it. They're staying home, they're being consistent there. But other people are like, well, I don't feel sick. I don't do anything. I don't understand. So trying to get a message out that this is a problem. The reason why we're trying to have people isolate and practice social distancing is important. but I think trying to stay connected with your employees. I know Iowa is pushing out loans for small businesses. They have a program there where you can apply for some of that funding to keep you going. I don't know if Nebraska has that as well.
We haven't had anything announced yet, but I think it's more than likely coming this week. Yeah.
So, and I think we need to be, generous. People don't know. And when we see somebody who's out, do we know why they're out? It's probably time to have a little bit of space for people, and literally and figuratively.
There's been a lot of discussion about this whole topic of social isolation, and then we saw loneliness come up. And we've been talking on our team, and it's really more about physical distancing than it is about social distancing. You still want to stay socially engaged with people like you put in your presentation, but physically we want to keep those parameters so that we don't spread, the virus any further. So, yeah. I don't have any more questions that came up in the chat box, but if I could keep you live for just a second, I'm going to take over the screen.
Okay.
And hopefully, here we go. So I just wanted to share with you guys today, if you can see my screen, just let me know. Here, I'm going to share it now. Okay. So as Diane shared with you, the Workforce Center's information, I also wanted to let you know that the Wellbeing Partners has actually put a open source page up for resources related to the COVID-19 situation. So what you have to do is you have to go onto our website right here, thewellbeingpartners.org, click the portal, and then come on down here. We've actually embedded in here the resources from Diane's team, everything that they've got. We've embedded them in here. And what we've done is we've added the community resources. So I'm so happy to see that the public health departments showed up, because we have several public health departments surrounding our Omaha area that we partner with very closely, and Pottawatomie County in Iowa, which is just across the border. And then in an effort to break things down in a way that might make sense about what types of information you might need, or types of situations you might be having, what we did is we broke these down by the 8 dimensions of well-being, which is how we promote our efforts, and then the social determinants of health here. So within each of these, you can just scroll over them, and you can find the information within those different dimensions related to support mechanisms. So whether it just be general, something for your family, we've even put information in here on things that you can do at home and your workplace. So we've embedded resources that we've received from health departments, from the Healthier Workforce Center, from the CDC, from SHRM, all of those. So basically a clearinghouse of information for you. And then here is the webpage for the Healthier Workforce Center of the Midwest. They have a ton of information in here as well. Wonderful information as far as, I love the fact sheets. You guys have the most amazing fact sheets. I think everybody should be using them. I love them. So I wanted to make sure that you guys also saw that there's a lot more to this site than just their COVID information. And then one of the interesting things that happened today when I got on was that Zoom actually asked me if I needed resources during the pandemic. So the reality is everybody's doing it. Everybody's trying to take care of each other. And we're really fortunate that, we're in a situation where we're able to provide support to each other via these types of resources. So if there aren't any more questions, then I think we're okay to exit for the day. Did you want to finish off with anything? Did you have anything you wanted to say at the end, Diane?
Just thank you for the opportunity. We're a resource. We're out there. Please feel free to reach out.